what is wrong with this baby.
And I really thought he was going to die.
He was afraid to find out just what it was.
It needs to come out, and it needs to come out as soon as it can.
My whole world just collapsed at that moment.
I think my husband and I cried all night long.
Next, 3 medical mysteries that defied the experts. For 3 years, Mary and Rich Jordan felt completely helpless as they watched their young son's unquenchable thirst slowly destroy him and their family.
We'd seen so many doctors by then, and they all told us he was fine. And I wanted to believe that.
Liz Holzheimer wanted desperately to have a baby, but while trying to create a new life, she almost lost her own.
I was like a walking time bomb. I really began to feel there's a missing piece to this puzzle, and I have to find it.
Jerry O'Meara suffered in silence for years with embarrassing symptoms, but when his vision started to deteriorate, it was too much for him to bear alone.
I couldn't take it anymore. I wanted my eyes back again.
When illness strikes, we look to doctors to give us answers. But what if they can't? For these unlucky patients, diagnosis is a mystery. Mary and Rich Jordan's daughter was 4 when they decided to expand the family and adopt newborn fraternal twin boys.
The babies were born and placed into our arms, and I can't explain how it felt. It was amazing.
Joey was actually the larger of the two. He was 7 pounds, and Patrick was 6 pounds and 2 ounces, I think. What you picture in your mind of a big baby, they had the roles of little tiny sumo wrestlers, they're just, tanks.
But despite their physical similarities, the twins begin to exhibit very different personalities.
Patrick was quiet, just kind of went with the flow. Joey, even from birth, would cry a lot.
Joe wanted food, he wanted his bottle. He wanted to be fed right away. And he would just suck on the bottle, and then, you'd have to pop it out of his mouth and get him to breathe for a second, and he would just go, and then he'd grab the bottle again and stuff it back in his mouth.
And he'd finish that bottle within a couple of minutes, and then he'd just projectile it out. You would just drape yourself with blankets because you knew the minute you fed him, he was going to vomit all over you.
The boys' pediatrician tells them not to worry. Joey's still eating, gaining weight, and seems healthy. But as time goes by, he gets worse.
He always cried at night, and it got really annoying, and it kept everyone up. And he was always thirsty and always hungry.
There were nights that I'd have to roll Joey's crib out into another room so that Patrick can sleep, because Patrick was sleeping through the night, and I didn't want Joey to wake up Patrick.
He would make a big racket that would wake up Patrick. Patrick is figuring, well, while I'm awake, I might as well have something to eat too. So we would both end up sitting there, and we'd be feeding them at the same time. And whoever had Joe would always get done first. They would have to deal with the throw up, but they would get to go back to bed quicker than the other one.
Joey's appetite is a little strange, but in all other respects, he seems normal.
Everything about him was normal. As the first year was going on, he'd roll over when he was supposed to roll over. He'd babble when he was supposed to babble. He crawled when he was supposed to crawl. But I knew as a mother, something isn't right, but I couldn't put my hand on it.
Gradually, Mary begins to realize that it isn't just the amount of liquid going into Joey's body that's astounding.
We would have to change his diaper at least every 2 hours. A lot of times, I'd put a fresh diaper on him, and as I'm taping it up, he'd pee. And one time of peeing would fill the diaper.
And we would weigh him, and I kept a chart, how many ounces is that diaper, and wow, a new record. Kind of bizarre behavior, but we were being driven to extremes because the situation wasn't getting any better. It was actually getting worse.
When the twins are 6 months old, Mary takes the boys to a new pediatrician. But he doesn't think Joey's odd symptoms are anything out of the ordinary. On the contrary, the doctor tells Mary that she may be the one with the problem.
I went in and I said, he won't go to bed without a bottle. Well, don't give him the bottle. Let him cry himself to sleep. So I tried to put him to bed without the bottle. And he screamed, and he screamed, and he screamed. I'm surprised neighbors didn't come knocking on the door to see what is wrong with this baby, because you've never heard anything so loud and so horrible. And the doctors were saying that I needed to become tougher and let him do it, but I couldn't. I just couldn't. I gave in and gave him the bottle.
I think a lot of the doctors thought that Mary was nuts. This woman comes in, she's distraught, she's obviously, at the end of her rope. She's complaining about a child that pees too much and drinks too much and throws up. Come on, lady, just relax, take care of your kids.
For 2 years, Joey has always eaten more and been bigger than Patrick. But suddenly, that pattern begins to change dramatically.
All of a sudden, we noticed that Patrick was outgrowing Joey.
Patrick was the linebacker, and Joey was the petite one. Joey was getting Patrick's hand-me-downs.
He stopped growing completely about age 2.
But again, the doctors would say, hey, sometimes that happens. Kids have growth spurts. So he's just at the end of a growth spurt.
We'd seen so many doctors by then, and they all told us he was fine. Even when he stopped growing, they said he was fine. And I wanted to believe that.
Over the next several months, Mary and Rich begin to notice another odd behavior.
He was very active, but he'd rather do things indoors. Did not like to be out in the bright sunlight that much without sunglasses. And we'd go through Batman sunglasses and Teletubby sunglasses and Barney sunglasses.
I thought he wanted attention because I was little and I wanted attention, and I thought he was trying to steal it from me.
And he would lick the back of his hand and then wipe his eyes, or we thought he was doing it to get moisture in his eyes.
Despite this peculiar reaction, Joey doesn't seem to be in any pain, and his vision checks out fine.
And so we just figured he was overly sensitive to the light, and his eyes were dried out because, there was just dry air.
Who are you?
The twins graduate from baby food and bottles, but Joey's taste in grown-up food seems a little bizarre.
Where most kids want candy, Joey wanted to eat salt. And we noticed he'd add salt to everything. No matter what it was, he'd put salt on it.
My sons would look at him and say, "Mom, what is he doing? It's already salty enough." And we would all sit there and just kind of go, "That's really disgusting." But he loved it.
I didn't think it was hugely odd. I thought maybe he had some bad taste buds or something like that. He just didn't get the idea or he liked the flavor of salt.
And if he didn't get the salt, he'd scream or cry. So we'd give in and kind of let him eat what he wanted to eat.
The twins are now 2.5, but the similarity ends there. Patrick has been sleeping through the night for months, while Joey is up 3 and 4 times a night screaming for water. Joey's problems are beginning to take a toll on the Jordans' lives.
Got to the point where we were both totally exhausted.
My husband and I were trying to take turns so that we'd at least get 3 to 4 hours sleep between us.
I don't think she got more than an hour's sleep for years.
And we kept going on the way we were. At 2.5, we were still up every hour or two taking care of him like he was a newborn baby. But nobody could tell us why.
For 3 years, Mary and Rich Jordan have been dealing with their son Joey's bizarre symptoms: an unquenchable thirst, projectile vomiting, excessive urination, and an intense craving for salt. All along, the doctors have told them that he falls within the range of normal. Not satisfied, Mary Jordan takes Joey to yet another pediatrician, Dr. Michelle Ernst.
She was young and friendly. We went through the history of Joey, and she listened to me and didn't say it's your fault.
Mary's manner was one of a concerned mom. She knew something was definitely wrong with her son. When he was in the exam room, for a limited time, it was 15 or 20 minutes that I was with him, he had 4 cups of water in that small amount of time and got kind of antsy if his mom didn't give him water. And I thought, that's kind of peculiar. So it made me think something's probably not right here.
She then did a physical on him and asked, "Has Joey ever been tested for diabetes?" And I said, "No, he's never been tested for anything." And Dr. Ernst then said, "That's the first thing we're going to do because excessive water drinking is a sign of diabetes."
Just a quick urine test that I did showed that there was potentially a problem.
The urinalysis shows that Joey doesn't have juvenile diabetes, but he does have abnormally high levels of sugar and protein in his urine, an indication that there is something wrong with his kidneys.
I knew something was wrong with my child, and she's finally saying there's something wrong with my child.
Dr. Ernst refers them to pediatric kidney specialist Dr. Sheldon Orloff to investigate.
The most striking thing I remember about him and his family is that he came with his twin brother, and he and his twin brother are markedly different in size. It was like meeting Mutt and Jeff.
Dr. Orloff came in and he looked at Joey and talked to Joey.
He's a very reassuring doctor. He's very calm. He knows what he's talking about. It felt really good to have an expert looking at him, because then we thought, we're almost to resolution now.
After hearing the litany of Joey's symptoms and the toll it's taking on the family, the first step Dr. Orloff takes is to prescribe a medication to treat Joey's excessive urination.
That in and of itself was a godsend. If we could get 5 hours of sleep a night, it was just like yahoo.
I wanted to try and show them that we could make their life a little bit better. And at the same time, I introduced this concept that he may have something else going on.
And everything seemed to be going great until he started ultrasounding the kidneys. And in one of the ultrasounds, they noticed that something was wrong with the kidneys.
We therefore proceeded with a kidney biopsy, in which we take a small part of the kidney out, look at it under a microscope, and try and make a substantive diagnosis.
Just before we brought him in for the kidney biopsy, we thought he's losing his kidneys. We didn't know what was going on.
You filter about 40 gallons of water out of your bloodstream every day through the filtering apparatus of the kidney. His laboratory tests showed signs of the filtering not working correctly.
The biopsy shows that Joey's kidneys, which should be absorbing nutrients and filtering out toxins, aren't. Everything is just passing right through them. This is a condition known as Fanconi's syndrome. Fanconi's is not usually a diagnosis in and of itself, but rather an indicator of another, more serious disease.
I was a little concerned, and then I was relieved at the same time, because now they clearly knew at the microscopic level, what the problem was, or at least I thought they did.
So now it was important to try and look at all the possible causes for Fanconi syndrome. One of the major organs that, aside from the kidney, which seems to be the target organ of this disease, is the eye. So I sent him to the ophthalmologist.
We were frightened. Does it mean he's going to go blind? So then we were dealing kidneys and blindness. I didn't know. The head of ophthalmology looked in Joey's eyes and within a few minutes said, Joey has crystals in his eyes. And I go, he has what? He has crystals in his eyes.
The ophthalmologist immediately sends Mary back to Dr. Orloff.
And Dr. Orloff had us right in and proceeded to say, your son has cystinosis, this is what it is, this is what we have to do for him.
Cystinosis is a rare genetic disease in which the amino acid cysteine wreaks havoc on the body. In a healthy person, cysteine is gradually absorbed by the kidneys. But with cystinosis, the cysteine builds up and forms crystals, which can lodge in cells and damage tissue.
This is inherited. It's genetic. It comes from a recessive characteristic in the two parents.
The crystals tend to gravitate to the eyes, which causes a sensitivity to light. And the buildup of cysteine in the kidneys means that they can no longer absorb nutrients or water. This leads to excessive urination, which in turn leads to dehydration, low potassium, and a seemingly unquenchable thirst. The inability to absorb essential nutrients can also result in stunted growth, kidney failure, and ultimately death.
So these children typically will crave salt and water to a point that they won't drink almost anything else, and to the point of even keeping them from eating to get the adequate calories they need to grow.
I was so scared. I went home, went on the internet, and the information was very, very frightening. Talking about kidney transplants, they talked about people dying at a young age, and I cried. I think my husband and I cried all night long.
remember when my sister told me what it was. I was scared. She didn't know what the future was going to hold for him.
Granted, it was not a good, happy diagnosis. At least we know what it is, and we know what we can do to make it better, or at least to make it less damaging than what it was.
There is no cure for cystinosis, but there are medications that can treat the symptoms and help prolong life. Dr. Orloff starts Joey on a drug to reduce the cystine content in his body, eye drops to remove cystine crystals in his eyes, and a growth hormone to help him catch up.
Before we understood the disease and could replace the missing chemicals, the children would die within several years. Now that we have the ability to treat the disease, they're living a much longer, healthier, and productive life.
The Jordans are lucky. Cystinosis is a difficult diagnosis to come by.
There are less than 2,000 people in the world with cystinosis. And that's not the first thing that jumps up at a doctor, because most doctors have never heard of it. Dr. Ernst was willing to go in and find out what was wrong. And it was our luck to find Dr. Orloff, who had treated cystonic children before.
You know, we're taught in medical school, common things are common, and you usually think of common things. So you have to be thinking outside the box to get to a rare diagnosis.
Thanks to proper treatment, today, Joey is thriving.
Between the various pills and these eye drops, which he only gets up once or twice a night now, and my son, who would not even go outside in the daylight because his eyes hurt, is now swimming in swimming pools and playing soccer and baseball and everything else.
He will need to take medicines for the rest of his life. Different types depending on where he is in his disease progression. And that eventually he will need to have a kidney transplant. Saying all that, he manages to do pretty well with life.
Joey is one of the toughest little boys I've ever met. Joey will do anything to just get on your nerves. He's like every other little brother.
Finally, the Jordans' sleepless nights have come to an end. And through it all, Mary and Rich have learned a valuable lesson.
If you know something is wrong and you need to push forward and work on that.
Go to as many doctors as you need to go to get the diagnosis. And don't take no for an answer.